Mark Klimek Lecture 2, Alcoholism Part 2. Focus, be a USRN, believe in yourself, pray and have faith in God. Overdose and withdrawals. In every abuse, drug is either an upper or a downer. Laxatives in the elderly is the #1 most abused class of drugs. When you get an overdose or withdrawal questions, ask yourself, is the drug an upper or a downer? Uppers versus downers. The names of the uppers are caffeine, cocaine, PCP or the psychedelic hallucinogens, methamphetamines, Adderall. Signs and symptoms of uppers. Everything goes up. Euphoria, tachycardia, restlessness, irritability, bowels, borborygmi and diarrhea, +3+4 reflexes, spastic, patient will have respiratory seizure, and the use of suction machine. Uppers versus downers. Names of the downers. Everything that is not an upper is downers. Remember, there's only 5 uppers, so the rest are downers like codeine, Demerol, Xantax, Valium, phenobarbital, marijuana, alcohol, etc. Signs and symptoms of downers. Everything in your body goes down. Lethargy, placid, patient will have respiratory depression leading to arrest, so use ambu bag. All the opposite signs and symptoms of uppers. Sample scenario. Your patient is high in cocaine. What's critically important to assess? Answer is check the reflex. If one of the choices is making sure that respiratory rate is above 12, don't choose this because the patient is high on upper, which makes everything goes up. You'd rather check the reflex. ABC or airway breathing and circulation doesn't apply to this patient. In answering this scenario, first you have to ask yourself, is the drug an upper or downer? Is the question asking about overdose, too much, or withdrawal, not enough, or too little? Too little upper makes everything goes down. Too little downer makes everything goes up. Upper overdose looks like what other downer withdrawal? Downer overdose looks like upper withdrawal. In what 2 situations will respiratory depression and arrest would be your highest priority? Answers: downer overdose and upper withdrawals. Which 2 would seizure be your biggest risk? Answer: upper overdose and downer withdrawals. Sample scenario. Squad calls you and says they're bringing in a patient. They're 10 minutes out. He's an overdose on cocaine. What would you expect to see? Select all that apply. In answering this question, first you have to ask yourself, is the drug an upper or downer? Is the question asking about overdose, too much, or withdrawal, not enough, or too little? Another example, overdose on cocaine. What would you expect? The answer, upper overdose, causing too much upper, system in your body goes up. Withdrawal on cocaine, what would you expect? System on your body goes down. Alcohol withdrawal syndromes versus delirium tremens. Alcohol withdrawal syndrome is different from delirium tremens. Every alcoholic goes through alcohol withdrawal syndrome 24 hours after they stop drinking. So if an alcoholic stops drinking alcohol within 24 hours, they will all go into withdrawal syndrome. Only a minority gets delirium tremens. When do you go into a delirium tremens? After you stop drinking. The time frame is 72 hours. Alcohol withdrawal first, then after a couple of days, delirium tremens. Alcohol withdrawal syndrome precedes delirium tremens. However, DT does not always follow AWS or the alcohol withdrawal syndrome. AWS or alcohol withdrawal syndrome is not life-threatening. DT or delirium tremens can kill you. Patients with AWS are not a danger to themselves or others. Patients with DT are dangerous to self and others. Difference between AWS and DT. AWS or the alcohol withdrawal syndrome, regular diet, semi-private anywhere, up at liberty, no restraint. DT or delirium tremens, patient will have clear liquid diet or NPO because they are risk for aspiration. They are in private room near the nurse's station because they are dangerous. Restricted bed rest, don't have bathroom privileges, and must be restrained because they are dangerous. Remember, on board exams, you have a perfect role. Assume you have all the money, all the time, enough staff, cooperative, and everybody is happy. Restraints on delirium tremens or DT. Do not use soft restraints and do not use 4-point. The patient need to be on a vest or 2-point lock leathers. 2-point meaning 2 extremities, lock one arm and one opposite leg. You rotate every 2 hours, then 2 hours later you switch it. Example, if the patient right arm locked down and left leg locked down. So as a nurse, you need to lock their left arm, then their right leg, then release the opposite.